So our topic is on shielding during upper extremity procedures. So we are basically going to demonstrate how to shield a patient during a procedure such as a hand x-ray or humerus x-ray. We're also going to talk about different types of shields you can use, and we're going to get into things such as exposure factors, collimation, concepts such as ALARA, basically all things that will also help protect the patient by giving them less of a dose.
Today we will discuss proper shielding techniques for upper extremity diagnostic imaging. Shielding, which is one of the 3 cardinal rules of protection, is a very important aspect that every technologist must take into consideration. There are certain areas of the body that are more radiosensitive to radiation exposure. Examples of the areas that should be protected include breast tissue and reproductive organs, which will be demonstrated shortly. We will also briefly discuss different types of shields and the effects of not using proper shielding techniques. Alright, now I'm going to demonstrate the proper way to shield for upper extremities. Actually, hurt her humerus. Oh god. Is there any chance of pregnancy?
No.
Okay. It's important to ask that, and you want to shield anyway. The different types of shields include gonadal shielding, breast shield, thyroid shield, and a flat contact shield. This is a flat contact shield. You will use this to cover gonads. And normally you would use a breast shield, but if you don't have one handy, you can always use another flat contact shield to put over the breast.
When the upper extremities or the breasts are being examined, especially when the patient is in a seated position, care should be taken so that the beam does not intercept the gonads. You should position the patient lateral to the beam and provide a protective apron as a shield. Contact shields, which are placed directly on the patient, and shadow shields are the 2 most common shielding devices used for area shielding. Gonadal shields should always be used when reproductive organs are within 5 centimeters of the primary beam, and should generally be used with all upper extremity x-rays to reduce the dose due to scatter radiation. Shadow shields can be suspended directly from the x-ray tube to cast a shadow over the patient's reproductive organs, blocking out the primary beam. Rolling shields can be used as a barrier to shield both the gonads and also the femurs when placed between the patient and the x-ray tube. Breast shields are contact shields that are used during scoliosis examinations. Scoliosis exams consist of an AP projection which subjects the breast to primary beam x-radiation. Also, PA projection, which is equally as effective because magnification is of little importance. The PA projection results in a breast dose of only 1% of the AP projection. Another way to protect the patient during an upper extremity x-ray is to use proper collimation. By collimating properly or restricting the beam, you will minimize the patient exposure by reducing the amount of scattered and absorbed radiation. Choosing the correct exposure factors by using the concept of ALARA, or as low as reasonably achievable, is another way to protect the patient during upper extremity x-rays. The risk of cancer increases significantly with radiation exposure for leukemia in most organs, such as the ones in red. The largest increase in risk is found for leukemia. For other sites, such as the ones in blue, data suggests a possible increase, but the risk results are not statistically significant. Nevertheless, for all types of solid cancer combined, there is a nearly 50% increase at a dose of 1 gray or 100 rad. Radiation interacts with certain risk factors. For example, the risk associated with radiation for developing lung cancer is higher for light to moderate smokers compared to non-smokers and is dependent on smoking intensity. On the other hand, there is no clear evidence that the degree of radiation for breast, bladder, or colon is modified by other risk factors. Those exposed in childhood have a notably higher risk of leukemia, thyroid cancer, and non-melanoma skin cancers than those exposed later in life. Radiation-associated increases in cancer risks persist throughout life regardless of age at exposure.